Hello and welcome to Pace Hospital's podcast, where we dive into important health topics that is uterine cancer, a condition that affects thousands of women worldwide yet remains widely underdiscussed and misunderstood. Joining us today, Dr. Ramesh Parimi, Consultant Surgical Oncologist at Pace Hospitals, who brings years of expertise in diagnosing and managing gynecologic cancers. In this episode, we will explore the importance of understanding uterine cancer, from its causes and warning signs to early detection and the latest treatment options available. Whether you are seeking information for yourself or a loved one, this conversation could make a real difference. So stay with us as we shed light on a critical issue in women's health. Dr. Ramesh Parimi, thank you for joining us at Pace Hospital's Hitech City. Let's start by understanding what is uterine cancer.
Uterus is the tissue or the organ in the body in the female, in the low tummy called pelvis. And this uterus is very essential for a woman to menstruate and also to bear children. So in Telugu it is called Garbhasanchi and in Hindi they call it as Achadani. So today I am here to tell you about the uterine cancer, which is otherwise called endometrial cancer in medical language. So endometrial cancer or uterine cancer is the same. And most of the times in uterus, the endometrial cancer is one which develops. So commonest uterine cancer is the endometrial cancer. So endometrium is a lining inside the womb, that is inside the uterus. That is called endometrium. 95% of the times it is the uterine cancer means endometrial cancer arising from the endometrium, the innermost layer of the uterus.
Dr. Ramesh Parimi, what are the types of uterine cancer?
There is also some other type of cancer which is not very frequent, which may be about 5% of the cases. That's called uterine sarcoma. So sarcoma means something which arises from the muscle. So the uterus has got endometrial lining innermost, then the muscular layer or muscular lining, and a thin sheet called the serosa, otherwise called peritoneal covering or serosa. So this innermost layer is endometrium, which is commonest site for uterine cancer. When the muscle of the uterus, as I said, sarcoma might arise at times, which is about 5% of the times. Out of 100 cases of uterine cancer, maybe 5 are sarcomas. So uterine cancer means it's the endometrial cancer.
Could you explain what are the causes of uterine cancer?
Why this cancer develops in the percentage of ladies? There are various causes for that, but the exact cause, to be honest with you, is not yet ascertained or understood. But there are contributory factors, or otherwise called risk factors, for developing endometrial cancer or uterine cancer. The main cause or the risk factor is the obesity. Gross overweight is called obese. Morbid obesity is one of the most common contributory risk factors for endometrial cancer, followed by what is called hormone called estrogen, or deprivation of progesterone and use of estrogen or hyperestrogenic state is another strong reason believed for development of this cancer. For example, some women who are in the menopausal age group might go for some pills called hormone pills to get over the menopausal syndrome, which consists of a series of ailments like hot flushes, lack of proper sleep, and sometimes feeling sick and fatigability, some rashes. All these things put together, the woman is very distressed. When she visits her OBG or gynec, probably she might be prescribed what you call the estrogen pills. So the hormone treatment of menopausal syndrome exclusively by estrogen and not combined pill including progesterone is one contributory factor. The other risk factor observed is the radiation. If a woman is radiated and radiotherapy given, high energy rays, radiation is called radiotherapy given to the lower abdomen, especially pelvis, in a younger age or some ailment or other, the chances of developing endometrial cancer or called second cancer at a later period of her life is also seen. So Pelvic radiation, as we call in medical language, is one of the risk factors. There is also a genetic factor called, germline mutation, and then some genetic background is called Lynch syndrome. LYNCH is called Lynch syndrome. This is seen in certain percentage of women who develop a large intestine, that is colonic cancer as well as uterine cancer. In this syndrome, or in this particular category of people, what happens, Lynch syndrome, what happens is they develop what is called non-polyposis coli, that is colonic cancer. So this non-polyposis colonic cancer is part of in a predisposed individual who might also develop endometrial cancer. So Lynch syndrome is another contributory risk factor for this. So early menstruation and late menarche, then followed by lack of children. One who didn't get pregnant at all, a woman who hadn't born children at all, or didn't become pregnant rather. Let me put it this way, sometimes there may be abortions and miscarriages. So a woman who never has become pregnant, a woman who has developed early menarche and late menopause is also at risk. This group of individuals, ladies, are also at risk to develop uterine cancer.
So, doctor, what are the stages of uterine cancer?
The endometrial cancer or uterine cancer is confined to uterus is roughly, just to make you understand, not gone out of uterus is stage 1, you can say. And in the stage 1 also there are A, B, C. A means only endometrium involved, B means probably part of the muscle has been invaded, and C means some it is appearing up to a serosa. That is stage 1. Stage 2 being the involvement of the cervix uterus, the last part of the uterus, which is a little away from the, different from the uterine proper body, is called cervix involvement. That also again you got A, B, C in that. This is all the details taken by the oncologist and pathologist before they stage the disease. Third stage is what is called the stage of the uterus where the vagina is involved and where the fallopian tubes may be involved, and there may be lymph nodes, like the lymph nodes which are present around each and every organ in the body. They may filter these cancer cells and they may enlarge in size. So the cancer spreading to regional lymph nodes through lymphatics is called lymphadenopathy, and when the lymph nodes are present is definitely stage 3, which can be made out by various imaging techniques. Stage 4 is where involvement of the adjacent organs, including the bladder, urinary bladder and the rectum, and distant spread into the abdomen and probably lungs. So this is called metastasis or stage 4.
Can you explain what is the prevalence of uterine cancer?
Now, what is the prevalence of this? How many people or how many women are affected by this cancer? It may be interesting to know, isn't it? The risk for a woman to develop a cancer is about 1 in 20. So, out of 20 individuals or ladies in the postmenopausal group, about 1 in 20 is the prevalence. 3% of the population is affected by this uterine cancer. So, in the woman population, 3% are the percentage or individuals affected by this cancer. So the chance of prevalence of this disease is 3 times. The chance of developing uterine cancer for a woman is about 3 in 100. That is one. Secondly, about 20% of the particular age group is about postmenopausal and postmenopausal age group is about 20%.
Dr. Ramesh Parimi, what are the risk factors of uterine cancer?
So, some of the risk factors are enumerated. Just to recapitulate: obesity, gross overweight, estrogen high content hormonal pill, or estrogen therapy given for some ailments, hormonal therapy, including postmenopausal syndromes. Then pelvic radiotherapy to the pelvis in the younger age group for any other cancer or indication. Early menarche and late menopause. These are the contributory factors apart from Lynch syndrome, which I told you. So, colonic large bowel cancer and endometrial cancer can be seen in the same individual.
So, doctor, when it comes to uterine cancer, what are some of the signs and symptoms that women should really be paying attention to?
So the symptoms and signs means symptom means what the patient complains, signs means what the doctor makes out. The commonest symptom is bleeding per vagina. In the menopausal group, it may be called postmenopausal bleeding (PV), or in the menstruating group of individuals between 40 to 50 years age, if the lady is still menstruating, excess bleeding or intermenstrual bleed. That means before the period sets in again, she has some spotting or bleeding PV. So between the periods, at the time line, she might have bleeding per PV, that is bleeding of the vagina from the vagina. So bleeding is the main cognizant symptom of presentation of this cancer. So any spotting or irregular bleeding in a postmenopausal woman who has cessation of periods quite a while ago is an important symptom and should never be neglected. The lady should consult immediately the doctor for further evaluation and ascertain the cause of this postmenopausal bleeding, which could be sporadic, spotting, or significant, to rule out uterine cancer. And those who are in the still menstruating age who develop intermenstrual periods, bleeding, irregular bleeding or excess flow, also should be cautious to consult and get evaluated for uterine cancer. Sometimes they present with low abdominal pain, that is called pelvic pain, some kind of cramps and all that. That is a little early, late stages, when the uterine cancer has spread to nearby organ or into the out of the uterus, it has gone out and then involving the surrounding tissues. So the commonest is bleeding per PV, second is pelvic pain, then some kind of anemia, that is lack of blood. Because of the loss of blood, there will be low hemoglobin level. There is the causes of some of the symptoms of this uterine cancer.
Could you explain what is the diagnostic test of uterine cancer?
Once a woman complains of irregular postmenopausal bleeding or irregular bleeding PV, the doctor examines for any anemia and other things, and also they do what is called pelvic examination, internal examination of the female genitalia, that is internal sexual organs, including the cervix and the uterus. By doing this pelvic examination, the doctor can make out the state of affairs, that is the size of the uterus, according to the age, whether it is compatible or size of the uterus is big and all that. They also do the next examination called the hysteroscopy, wherein they pass a small flexible tube through the cervix into the uterus and then see the endometrium and all that. If there is anything amiss, later on probably somebody could also take a biopsy from the endometrium to prove or disprove it. And lastly, the other important test they do is a little invasive called DNC, dilatation and curettage. Curettage means taking out bits of innermost lining, that is endometrium, where from the cancer arises from different parts of the uterus. So that is the final test, and all the scrapings and the bits of tissue removed through hysteroscope or through DNC are sent for examination, pathological examination called histopathology, which would clinch the diagnosis. Apart from this clinical evaluation, that is examination in general and pelvic examination and interventional techniques by the attending gynecologist or doctor, there are some other non-invasive techniques that is called scans. One is the ultrasound scan, which is very simple and also quick and 100% non-invasive. It will give the thickness of the endometrium, whether commensurate with the age or not. You can make out any other pathology in the uterus, including suspicious malignancy, that is uterine cancer. Then there is what is called CAT scan and also MRI. These are the advanced imaging techniques wherein we find the entire configuration of the uterus and the irregularities and any other lesions or nodules or foci of cancer within the uterus, that is uterine wall, can be made out. So with all these investigations, one suspects, then diagnosis and confirms it, and also after biopsy, the staging is done. Depending on the stage of the disease, the treatment is given.
Dr. Ramesh Parimi, what are the treatments of uterine cancer?
So the treatment consists essentially of surgery. Most of the uterine cancers which are diagnosed likely a little early compared to other cancers, let me put it this way, amenable for treatment and curative treatment is well assured. So the mainstay of treatment is surgery, that is removal of the uterus. In stage 1, probably uterus along with the uterus, one side, both sides, there is fallopian tubes and one ovary along with the cup of vagina and cervix are removed. But in advanced stage, it is called total hysterectomy or rather radical hysterectomy with bilateral salpingo-oophorectomy and removal of a cup of vagina. This is what is called the radical hysterectomy. Along with this surgery, please remember that lymph nodes have to be dissected. Rather, the name of the operation for uterine cancer is called surgical staging. So it is very prudent and important on the part of the operating surgeon not only to knock off the uterus and other tissues, but also the lymph glands have to be done, pelvic lymphadenectomy. So this is in short the surgical treatment, which is the definitive line of treatment for uterine cancer. Apart from the surgical treatment, there are also other modalities. Now the surgery can be either a kind of minimally invasive surgery or an open surgery, depending on the expertise and the indication of the patient. Expertise of the surgeon and indication, patient's stage of the disease and all, amenability and all that. So surgery being done, if necessary, radiotherapy is also given in these cases, or those cases where surgery is not feasible for any medical reason, scientific reason, or patient refuses surgery, unfortunately for any particular reason. Radiotherapy is a choice, but it's only second line of treatment. The first choice is surgery. So chemotherapy is also there, where cytotoxic drugs are given mixed with saline and glucose by medical oncologists, and immunotherapy is also coming in a way. Then there is what is called targeted therapy. These are various other modalities of treatment. Early diagnosis and availability of good surgical expertise and a fairly simple surgery is the key for high cure rates in this cancer, particular cancer. The cure rates can be, there is 5 years survival, 10 years survival can be as high as 85% to 81% to 95%. So when early diagnosis is made and good surgery is performed, complete surgery, then the life expectancy can be as normal as any other individual or lady without cancer. She will be cured of it. So 95% cure rates are also seen. There is 5-year and 10-year survivals in these cancers in various centers.
So, doctor, when we talk about uterine cancer, is there a particular age group that is more commonly affected?
The age in which this uterine cancer, that is endometrial cancer, develops is roughly about 51 average or 55 years. That means it develops after the menstruation ceases in the woman. It's called a menopausal disease. Generally, in the menopausal age group, we commonly see this. It's not very common in younger age groups who are menstruating. So, the commonest age group in which uterine cancer is found is about average 51 years. In some centers and countries, rather, it's about 55 years. So, as I said, this is a generally menopausal cancer. Now, menopause means, as I told you, it's a cessation of periods. The woman is not menstruating anymore. She has stopped menstruating. That's called menopause.
Dr. Ramesh Parimi, one final question. What are the preventive tips for uterine cancer?
Or any preventive measures you think are needed. Actually, there are no any preventive measures as such, but only to have a good lifestyle. Screening is also not available for this cancer. So the best way is to try to prevent it by keeping proper body weight, good lifestyle, avoiding diabetes, avoiding overweight, there is obesity, and avoiding high estrogen content pills for whatever reason one is prescribed.
Thank you, Dr. Ramesh Parimi, for sharing crucial information regarding the uterine cancer to our listeners. Hope this information has been helpful to our listeners. If you have any further questions regarding uterine cancer, please don't hesitate to consult a qualified oncologist or gynecologic cancer specialist. Remember, managing uterine cancer is a journey filled with both challenges and triumphs, but you don't have to face it alone. With the right support, medical guidance, and knowledge, you can take control of your health and confidently navigate the path towards recovery and resilience. We will see you soon on Pace Hospital's podcast with another episode focused on your health and well being. Until next time, take care, stay informed, and stay healthy. Thank you for listening.